And joining us now, Dr. Michael Osterholm, Director of the Center for Disease Research and Policy at the University of Minnesota. It's always good to talk to you. Let's get a reality check about these college spikes.
Okay.
And we all know how important it is for parents, for the kids, for the college students to get back to school. But what are you concerned about their health and safety?
Well, we're all concerned about the health and safety of the students, of the faculty, of the staff, of the parents and other SIBs who are at home when those students return back from school and if they're in school. And I think that the message we have to get across is, number one, we're going to have cases. You and I have talked about this on this very program in weeks before, that with the opening of schools coming with colleges, universities, high schools and grade schools, we're going to see a substantial increase in cases. And that's what's happening. I think the message we have to get across is that the virus is the enemy here. It's not the teachers, it's not the administration, it's not the parents, it's not the students. And this is really our COVID year. We have to understand it's not going to be perfect. It's not going to work the way we surely want it to work or the way it worked in the past. So how do we make it work the best just to get us through this situation with this virus?
And we hear from schools, many schools working so hard for single rooms, for changing the meal service. There are shared bathrooms, of course, in many of these dorms, which is a problem, potential problem. But it strikes me that it's really the personal behavior of the college kids at that level. And you know this being on a campus. It's whether they're partying, whether there are off-campus parties that really can't be patrolled as easily by the administrations of these colleges.
Right. You know, no institution, whether they're a college or university or they're a high school, can in fact protect students from themselves when they're out and about, not on the campus or in this classroom, meaning it's their behavior. And some will say, well, you're sounding like you're blaming them. No, we're asking them to be responsible, just like we don't want them to get drink too much and get behind the wheel and go home one night. Understand that you are going to have a consequence if you get infected with this, in the sense you can transmit to others, including those who might not be in the same risk category you are for severe disease, meaning many of these people won't get severe disease, but they may pass it on to mom and dad, grandpa and grandma, or their teachers that are sick. The final message I'd give to them, please understand, we're beginning to see a growing number of young, healthy adults who get infected with this virus that go on and develop what we call the long haulers condition, where we're now seeing individuals who were not hospitalized, but 3, 4, and 5 months later are literally not able to go back to school, go to work, live a normal life. This is a real challenge, and so you don't want to get infected with this virus. Just don't.
And we hear of advances in testing. Will some of these advances make it more practical for campuses to test all of the incoming students and repeatedly test them?
Testing is a very important part of our response, but I have to be really clear. You cannot test your way out of this pandemic. If I test you today, it doesn't mean that tonight you don't get infected, and tomorrow, you're now in the community, and within 2 or 3 days after that, you transmit again. So we have to understand testing can be supportive. It can help. But at the end of the day, it's still about our own behavior. It's distancing, distancing, and distancing. Right here in Minnesota, we've had over 50 outbreaks in bars where young adults primarily all congregated together, closely together, transmission occurred, and now it's spreading through the community. So again, we have to have people understand it's your behavior that will determine how this goes, how safe schools will be, how your mom and dad or your grandpa and grandma will be able to feel safe, or how, for that matter, long-term care facilities will keep the virus out. So I can't make this message any louder or clearer to young, healthy adults. I understand you want to party. I understand you're at that time in your life where socializing like this is important. But if you do that, the consequences today could be substantial.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.